I wouldn't necessarily say it's my approach, but the difference between, let's say, our modern medical approach and a more alternative, holistic, natural approach is partly one which would be philosophical. And again, I come back to that core innate wisdom, let's say the core innate physician within each person. That would be more towards the natural approach to wellness versus a system which sees symptoms and illness as possibly an indication that the body needs to be assisted or controlled in some way to keep it from going in the direction of let's say pathology. So there's something that is between both of those systems. There's something that we have in common, and that is what I mentioned before about this homeostasis, which was brushed over very quickly in physiology and medical school pre-med as this underlying wisdom which is always keeping all the systems regulated. So the natural sort of approach is the question, why has the body come to this point of imbalance and producing symptoms and illness versus the other system which may not necessarily recognize the wisdom and wants to, again, as I said before, use drugs or synthetic materials to control or to reduce the person's symptoms. And sort of in a nutshell, that could be the difference between the two systems. So it's a philosophical difference. It's a recognition in one side of this wisdom within, and what we try to do, and even in this holistic alternative field, there can be many approaches, many different types of assessments of why the person has produced the symptoms. So you can use natural substances, natural materials, or herbs and supplements to help the symptoms, but not necessarily to get to the underlying causes or the core of the reason why the person is not feeling well. So that's pretty much the difference between the two different camps. But, the medical system right now, I think, is becoming less attractive, partly because people do realize that they want answers. Doc, I'm not feeling well. And in that stage where the bowl is initially starting to spill over and producing symptoms, and nothing is coming up on the lab reports, the doctor is trying to find out the reason or the diagnosis of the person's condition. And when they can't diagnose, and even when they can diagnose this, the person still wants to know, why am I in this state? The usual response is too much stress, it's a genetic predisposition, etc. But the answers are not being given, which frustrates the person, the client, the patient. They want to know why. They want to know what they can do about it to help correct the problem, rather than just simply being given a drug. And this is becoming more and more of the attitude of our population, is not to necessarily accept the recommendation or prescription from the doctor, but rather, how can I improve my health? And as we know, the drugs will relieve symptoms, but do not necessarily improve the health or the vitality of the person. Again, this camp is saying, let's figure out the causes, hopefully. Let's address those causes, let's remove those causes, and your health will be better. That is a system which I consider to be the approach to cure, while the other system is improvement of symptoms, but I don't consider it necessarily to be a cure being the restoration of your health.